Hi everyone, this video is going to be over some key points for your preparation for the video reflection that's due in week 8. Real quick, the videos that came in for midterm were wonderful, they were great. However, there's always room for improvement. So, I'm jumping right in with this. The first point is review the rubric. Please take the time to review that rubric and make sure all of the elements align with the video. Have the rubric out as you review your video presentation. The second thing is the outline. Prepare yourself an outline. This is very helpful so you can determine the points you're going to discuss, the content that's fitting within those points, and how you're going to present your visual aid as well. This also helps you align the message and the purpose relevant to the video reflection that you're presenting. The introduction. So, make sure your introduction is very attention-getting. Right off the bat. Hello, my name is Lydia Mejia Johnson. I'm going to discuss 3 important topics that I've learned thus far at midterm in my video reflection. One is nursing theory. The second is evidence-based practice. And the third is one of Sister Roach's 5 C's of caring. Competency. Period. Attention-getting and to the point. The second part of that introduction should include why that's important. To me, these 3 subject matters are important because of my practice. I wish to be a nurse educator on my unit and feel that these 3 are very important. Highly the most important to me is evidence-based practice. Okay, there's the second point brought in. Make sure you define terminology as well. So I mentioned evidence-based practice. Let me share with you the definition of evidence-based practice. Evidence-based practice is the integration of best research evidence with clinical expertise and patient values to facilitate clinical decision-making. So what I wish to share with you now is a clinical evidence-based model that I wish to implement into my unit. As you can see here, this model demonstrates a Venn diagram. In the center of it is clinical expertise, with the other 4 major concepts surrounding it that align with the clinical expertise. This is very important to the profession of nursing and also to integrate evidence-based practice and disseminate it to the best of my knowledge. Okay, there's the visual aid brought in. Nicely stated, nicely done. The next point I want to bring to you is timing. Yes, 2 to 5 minutes. I feel some of you are cutting your time short. Make sure you go back and review and practice edit, review your video to include the elements in that rubric. It's okay to have that rubric out as you walk through your own video. Conclusion. Make sure your conclusion is succinct and to the point. It needs to tie up the major points that you brought out into your video presentation you stated early on. For example, I hope you've enjoyed this presentation. In conclusion, the main takeaway points are practice your skill in videoing yourself. Have your rubric out, time yourself, make sure you have an audible, clear, distinct voice, enunciate well and pronunciate well, include the visual aid, and make sure that you're dressed professionally as this is a professional presentation to be given. Thank you for your time today. There, that ends it. It's a clear, distinct conclusion of the points I will address or have addressed. So, review your rubric, prepare an outline, make sure your introduction is very eye-catching, very attention-grabbing, review and edit, timing yourself 2 to 5 minutes in length, a clear, distinct conclusion, an audible, clear voice, inclusion of the visual aid, make sure it ties into one of the topics, the dress and attire that you have is professional demeanor. Thank you very much. I hope you have taken away from this video some good points in preparation for Week 8's final video reflection.